What's up, y'all? It's your girl, America Jones, and welcome to another episode of Therapy Thursday. This one is special, though. We've wrapped for the season, but this conversation is so imperative as we move towards 2026. We've got some big changes coming to our health exchange with the Connect for Health Colorado, and I've got a professional here, a broker here that's going to talk to us a little bit about what to expect in that exchange. But also we're going to talk about that stress, that pressure as we move into entrepreneurship, or maybe we've lost our jobs and have to seek coverage. So sit tight, hang in there. We're going to have a great conversation today, and I'm so excited for you to be joining us. Welcome once again. I'm America Jones. Welcome to Therapy Thursday. I'm super excited. We definitely want to close out the year in a really powerful stance. We've got some special guests joining me today, and you know how I love it. I love my guests, and that's the way we do it. We're going to talk a little bit with our special guest, Sean Casaros, and Sean represents as the owner and principal of SCIA Health Insurance Companies on behalf of our partner and sponsoring partner, Connect for Health Colorado. Welcome, Sean.
Thank you for having me.
And my EDCI cohort, friend, my family, because that's what we are to me, you know. I'm excited to have Rosina Schroer. I always mess up her name. Rosina Schroer Santiago.
There you go. Yes.
Joining us, but let me tell you a little bit, and I'm gonna brag on you for like 2 seconds here. She is the illustrious founder of Therapist of Color Collaborative. So when I was doing my on-air show, we used to mention this collaborative so often on the air for the work that you were doing and have been doing and continue to do as a healer in our community. And you've got a little new special sauce coming up soon too.
Yes, we do.
Yeah,
Yes,
so
we do.
we're excited about that, and we're excited to have an engaging conversation. What we're gonna do is we're gonna take the positive approach, the proactive approach to the changes that are coming up to healthcare, and be able to have an earnest conversation, ask the hard questions, and really dig into the information, but also give ourselves that solace. It's the end of the year. Can be very stressful. We can be dealing with the loss of a loved one. We can be dealing with isolation and loneliness. We can be dealing with the loss of a job or maybe a transition. Anything could be happening during this time of the year. Then we add on some healthcare to it, the whole lot to be carrying. We definitely want to thank our sponsors, Connect for Health Colorado. This is happening because of them. Thank you so much for believing in what we do here at Therapy Thursday. We want to thank the Museum for Black Girls. We're right here once again for this special episode. Phonetics Urban Athletic Wear, who provides us with our gear and our clothing. We also want to make sure that we thank Solar Radio, which is the new project. That's our new baby that's coming up in 2026. So thank you to all of the folks that are supporting us and helping us bring Therapy Thursday forward. All right, with that being said, Sean, you ready?
I'm ready. Let's do this.
Let's jump right in. Thank you once again for coming and supporting Therapy Thursday and also bringing this information forward. As a person who uses the exchange, it was kind of scary. And I don't know if I would have been able to navigate it without a broker like you, right? To be able to understand these big words and these concepts around, do I need this kind of coverage, or is this the right thing to choose? There's a lot of questions. What advice can you give folks that go and they look at Connect for Health and they say, okay, now what do I do? I'm overwhelmed.
I've gotten a lot of that over the last 11 years. One thing about being in this is that you learn to navigate the system, educate clients on how to get through it, and that everything's going to be okay. It does look intimidating at first. There's several process to that in getting enrolled. But the one thing to keep in mind that there are navigators, brokers like myself who are out there who provide this navigation at no cost to consumers. Connect for Health Colorado really promotes the use of navigators and brokers to facilitate the enrollments to the carriers on behalf of Coloradoans. But it's been exciting. I've done this since day one, since Connect for Health Colorado came out. I was one of the first licensed brokers internally with them. So I've gotten to see what it's like during an open enrollment, to see the call volume and the work that they do behind the scenes, and kind of being on the front line allowed me to kind of get out there and uh, put my skills to use as far as educating my community and letting them know that there's resources and tools out there available to them. It's just connecting with those individuals. Uh, Over the years, Connect for Health Colorado has gotten good at promoting that. They've uh, on their website, there's direct access to a broker or navigator in areas based on your zip code. So it's very easy to find that help. But the one thing about that, a lot of people think it's going to cost you money to work with these individuals. It doesn't cost a penny. We're here to help you guys get through an open enrollment or a special enrollment period. But we're here to help navigate all that.
I think that's really important. I think so often we don't have that knowledge base.
Yeah.
And we think that, is this a trick? Is this not real? There's no way somebody wants to help me for free. We kind of get stuck in that kind of space. But enrollment is closing soon, right? In January?
Okay, so we just went through the first big push, which was December 15th. All those individuals who wanted coverage to start January 1st were enrolled by December 15th. Those individuals who didn't know there was an open enrollment period, or just were a little late to the party and just saw a big rate increase and were like, I'll deal with it later. Those individuals have till January 15th. Their coverage starts February 1st. You'll be able to enroll throughout the year if there's special enrollment periods or what we call life-changing events. You can turn 26, have a kid, somebody passes away in your family. There's going to be several circumstances that would allow an individual to have an access to a special enrollment period. So because you miss it now doesn't mean that there may not be an opportunity later in the year to get coverage. And there's always an opportunity to apply for state programs, Medicaid, Health First Colorado, CHP Plus. Those are programs that you can apply every month. As long as you income qualify, you can be eligible for those programs. If you're coming off those programs, triggers the special enrollment period. You've lost medical coverage. Now you're eligible for Connect for Health Colorado. And that's where we're going to come in and help you navigate through all that.
Lots of information, and it's super intimidating, right? It's intimidating in those spaces. I want to ask Rosina, when we find the doctors and the care providers that we love, and then something happens and we have to navigate through that, there's a level of stress that happens in those spaces. Will you talk about how we can cope, or give us some coping mechanisms when we're in those kind of spaces and find ourselves challenged?
Yeah. First and foremost, when it comes to this topic just in and of itself is a part of the social determinants of health. And the social determinants of health are the things that, as communities of color and underserved communities, we suffer the greatest impact due to this. And basically, like health literacy, if we don't understand the systems that we're going into, if we don't understand the whether it's the panel, the provider, the network, how to access it, the cost, it's keeping us away from the vital care that we need. And so if you can't get the health checkup, right, you can't do the preventative care, well, then you end up doing the reactive care because you're dealing with some either minor condition, a crisis condition, or an emergent condition that turns into something chronic. So when your health is not well, right, you're not able to be present for work. So we start talking about like presenteeism, absenteeism. We all, right now, there's a lot of people across the country rubbing our dimes to make some dollars. And so financial stress, right? So you're navigating health, you're navigating your mental stress. So I think the biggest thing when it comes to just like what you can do to get a handle on your mental is inform yourself, right? You have to become literate about the concerns that are most important to you. So whether it's knowing what resources you have when you can't afford resources. There are free clinics that are popping up, right? Find the free clinics in your community. Tap into human services, whether Human Services, Denver Human Services, DEFCO, right? they publish a lot of information.
Mhm.
There are also other platforms like the Colorado Black Health Collaborative, right? In community, we have the Center for African American Health.
Yeah.
They also, I mean, Center for African American Health actually has, I don't want to mispronounce the name, Dr. Gerardo, I think it is.
Mhm.
And he's actually hosting like free clinics
Yeah.
at
Super
the Center
exciting.
for African American Health. So when times like this come up, it's important to stay connected to community because there are lots of resources that come up within community for us to take care of ourselves. And so I think as far as that tool says, or I guess what I'm saying is stay connected to community because not only do you sometimes end up getting sick in isolation, but healing does happen in community. And so it's being literate, knowing where to tap into it, and not being afraid to ask for the resources. It doesn't help you, and it's not courageous, and it's not bold, and it's not brave to sit there and suffer in silence. So sometimes you got to be able to open your mouth and ask for the care that you need. It might start at a grocery store. It might start when you're picking up your kids in car line. Wherever it is, ask for the help that you need. I know most elementary schools, middle schools, everybody's doing food resources,
Yeah.
right? Churches, right? There are so many different resources. So your mental, when it comes to your health, those two things are happening and get disrupted simultaneously. And if your mental is not right, leads to migraines, upset stomach, GI issues. And as those persist, it can put you at risk for even more serious things, you know, whether it's cancer, cardiac events. So it's important to take care of you. In times of distress, you have to slow down just long enough to pay attention to what's happening and be willing to ask for the help. Do not stay disrupted.
Absolutely. See, this is why I brought her. She's brilliant, right? She has so much to share. And I think that the co-op between you two is like, this is the perfect storm of excellence,
I see
right?
that.
And that's what it is. Again, like piggybacking off of what Rosina was talking about resources and access and information. Can you go over a few things that might impact the community now, like with respect to like some of the available resources, some of the information that can lead someone into actually securing coverage? Because sometimes you look at it and then you get super intimidated and then you run away and you're like, I'll do it later. And then later happens, but later happens when you're laying in a hospital bed.
Yep, and
Or
it's too
later
late.
happens when your loved one gets in an accident and something happens and now you don't have the coverage and now you're trying to backdate it and do all these different things. So how can a person be proactive? And especially with, we have two big factions of folks out, right? We've got our elderly and we've got these youth.
Mhm,
And both of them need this coverage.
mhm.
So what resources?
So, I mean, a big problem is when somebody is coming off a plan. Let's say Health First Colorado, for instance. Let's say you forgot to do your redetermination for Medicaid, and that happens a lot. You get mail correspondence, several pieces a week, and it goes wayside. Well, you forget to verify income, citizenship status. They're going to take you off those programs, and at that time, there's a lot of individuals who will go until they realize that they need to be seen. And at that point, well, you don't have coverage. At that point, what you're going to want to do is start looking at what's available as far as Connect for Health Colorado. In other states, it's going to be a little different. Some rely on the federal website, healthcare.gov. But here in Colorado, our state exchange is going to put you in resources to get healthcare coverage. What that's going to do is trigger a special enrollment period, and it's going to allow you to look at those other options. The one good thing about the options through the exchange, they're going to meet the minimum essential requirements. They're going to have certain benefits that are in those healthcare plans that some plans that are offered don't have. And mental health is one of those benefits that ACA plans have to cover. And you're going to see that the carriers have geared a lot of their plans, whether it's a high deductible plan to a gold plan with a lower deductible. They're all going to have some type of coverage for mental health. They see that it is a benefit that's being used, and they want to make sure that individuals have access to that. But with that being said, it's just knowing what coverage you have at the time, and that you just want to stay on top of stuff like that, especially if you're getting assistance through the state or even Connect for Health Colorado. They generate correspondence being sent out that individuals who here in the United States have access to healthcare. It's going to be citizenship status, work requirement information, and income. So those letters also generate. So if there's ever a lapse in something like that, there's going to be a time where you're going to want to reach out back to Connect for Health Colorado, where they can put you into a point of contact like myself. But with that being said, there's other resources out there like Aunt Bertha. Aunt Bertha is a free website that puts people into contact with certain social service programs. It could be for heating assistance, rental assistance, food assistance, but that's going to be a new entity that came out recently was findhelp.org. Find Help is putting individuals with partners such as myself to help navigate the healthcare enrollment, or even individuals seeking assistance for mental health help. And there's going to be places out there, but you just want to reach out to somebody who knows how to put you in the right direction.
Absolutely. I have a question for you.
Mhm.
So we know that there's been a lot of discussion about, of course, immigration, our citizenship that is around, and our folks that are in the community that are in that space. And there has to be great fear and trepidation. Getting that coverage and figuring out, like you're saying, being empowered.
Mhm.
But what if you really have that fear of, like, if I come out and say, I'm here and I came with my family and I want to be a part and contribute and do whatever, but I need healthcare, but I'm afraid.
Mhm.
So what do we say to that community? Because they are a part of our community as well.
Absolutely. I mean, I think, you know, offices like mine and several other colleagues of mine are doing, you know, more specific things to create safe spaces within their offices, you know, that create some of that protection against like ICE and things like that. And I think it's really important, you know, all those know your rights, activities and events that are popping up, like stay in the know, right? Stay in the know. When it comes to like what our records and stuff, I mean, I know most of us as clinicians are doing our part also to like make sure the information that we're disclosing in our notes are really protecting, right, the clients that we serve, you know, keeping it to what is necessary and not like putting more than what is necessary, right? Because we're trying to preserve and protect the confidentiality of the folks that we're serving, but we're also trying to create spaces where folks can feel a trust and a confidence to know that they can get the help that they need, because it's not easy asking for help, and it's super vulnerable when you're sitting there talking about like, I feel like something's wrong with my mental, right? Like I am sitting here, I'm really distressed, I'm really distraught, and I need to talk about these things. And then you mentioned like grief and the holidays, or you know, just sudden death loss, employment loss, loss of identity. I mean, there's just so much loss just in general, that creates a lot of grief. And so as folks are thinking about what this season looks like, it's so important to just be willing to be in a space where you can tap into the resources that are there so that you can truly get the care that you need.
Absolutely.
But do not be afraid to ask for help, because there are absolutely people out there willing to help.
Yeah. Not wanting to suffer. I think, you know, that's part of the reason why we started this podcast was, you know, and started this as a radio program and all of these things was don't have to be alone with suffering. We want those opportunities to be able to say, maybe I'm not by myself and maybe I'm not really this island, but we really can reach out and reach into community and know that you're going to be okay.
Absolutely.
And that there are people that want to help you.
Absolutely.
But you have to give yourself that that space for vulnerability.
Yes.
And trust your own spirit.
Oh, yeah.
Right? Trust your spirit to say, it's okay. It might be a little scary first time you make that call or send that email or ask a friend for a referral, but it's so important and so critical. We are so grateful that you have joined us for Therapy Thursday. We'll be back with part 2 a little bit later. Once again, we want to thank the Museum for Black Girls, Phonetics Urban Athletic Wear, Solar Radio, and of course, Connect for Health Colorado. Once again, Therapy Thursday, I'm America Jones. We appreciate you being with us.